Omega-3 rich fish and seeds, the delicious, natural way to keep your heart strong as you age. Are you looking for simple, everyday foods that can lower your cholesterol, improve circulation, and protect against heart attack and stroke, all without complicated diets or expensive pills? The right omega-3 sources can reduce inflammation, keep your arteries flexible, and help your heart work at its best well into your senior years. In today's video, we're revealing the best fish, seeds, and safe supplement options to give your cardiovascular health a real boost, plus practical tips to make them a tasty, regular part of your routine. So stick around because you won't want to miss these life-changing nutrition strategies for a healthier, longer life. Before we get started, I'd love to know where you're watching from today. Drop a comment below, share your thoughts or questions. And don't forget to hit that subscribe button and turn on notifications so you never miss a heart health tip from our channel. As we age, our blood vessels naturally lose some of their elasticity. This means they can't expand and contract as easily as they once did, making it easier for bad LDL cholesterol to stick to the vessel walls. Over time, these deposits can lead to a dangerous buildup known as atherosclerosis, which is one of the leading causes of heart attacks and strokes in older adults. For many seniors, this process develops silently over years, without noticeable symptoms until a serious event occurs. This is where omega-3 fatty acids, especially EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, play a powerful protective role. Think of them as your cardiovascular maintenance crew, working quietly but effectively behind the scenes to keep your heart and blood vessels in better shape. One of the most important benefits of omega-3 is their ability to reduce blood vessel inflammation. Chronic, low-grade inflammation in the arteries is now recognized as a root cause of many forms of heart disease. By calming this inflammation, omega-3s help prevent further damage to the vessel walls, making it harder for plaque to build up in the first place. They also work to lower triglycerides, a type of fat in the blood that, when elevated, significantly increases cardiovascular risk. High triglyceride levels are common in older adults, especially those with diabetes, obesity, or a diet high in processed carbohydrates. Omega-3s help bring these numbers down, offering a meaningful layer of protection. Another critical function is preventing the formation of blood clots. Blood clots can suddenly block blood flow to the heart or brain, triggering a heart attack or stroke. Omega-3s make platelets, the blood's clotting cells, less likely to clump together, reducing the risk of a life-threatening blockage. For seniors prone to irregular heart rhythms, particularly atrial fibrillation, AFib, omega-3s can also help stabilize the heartbeat. A steady, regular rhythm supports better circulation and lowers the chance of complications like stroke. The Mayo Clinic notes that omega-3 fatty acids also improve endothelial function, the performance of the thin inner lining of your blood vessels. When this lining works well, blood flows more smoothly, and vessels can respond better to changes in blood pressure or activity levels. This improvement can translate into more efficient oxygen delivery to your muscles and organs, supporting overall vitality. In essence, omega-3s help counter several of the most serious cardiovascular risks seniors face: inflammation, high triglycerides, clot formation, and rhythm disturbances. While they can't replace healthy lifestyle choices like regular exercise, balanced eating, and not smoking, they serve as a valuable ally in keeping the circulatory system functioning at its best well into the later years of life. For older adults who want to stay active, independent, and free from major heart events, making sure they get enough omega-3s, whether from diet or supplements, is one of the smartest long-term health decisions they can make. Fatty fish are one of the richest and most direct sources of the omega-3s, EPA, and DHA, which are especially beneficial for heart health in older adults. Excellent choices include salmon, mackerel, sardines, herring, and tuna. To get the full cardiovascular benefits, it's recommended to enjoy 2 to 3 servings of fatty fish per week, with each serving being roughly 5 to 4 ounces of cooked fish. Cooking method matters just as much as the type of fish you choose. Baking, broiling, or steaming preserves the delicate omega-3 fatty acids, while frying can destroy some of these healthy fats and add harmful trans or saturated fats. For example, a piece of salmon baked with herbs and lemon not only keeps the omega-3 content intact, but also avoids the extra calories and unhealthy oils found in deep-fried preparations. Plant-based eaters can still get valuable omega-3s, primarily in the form of ALA, alpha-linolenic acid. Good sources include chia seeds, ground flax seeds, and walnuts. While ALA is a different type of omega-3, the body can convert a small portion into EPA and DHA, though the process isn't as efficient as getting them directly from fish. That's why plant-based sources are best used to complement, not replace, marine-based omega-3s whenever possible. Adding these plant-based options into your daily meals can be simple and tasty. Sprinkle chia seeds or ground flaxseed over your morning oatmeal, stir them into yogurt, or toss them into a smoothie. Walnuts can be added to salads for a pleasant crunch or enjoyed as an afternoon snack, giving you both omega-3 and heart-friendly fiber. For those who don't like the taste of fish or can't include it in their diet, supplements can be a practical alternative. Fish oil capsules provide concentrated EPA and DHA, while algae-based supplements are an excellent choice for vegetarians and vegans. Algae oil delivers omega-3s in the same form found in fish, since fish get their omega-3 content by eating microalgae in the first place. However, supplements aren't a one-size-fits-all solution. The Cleveland Clinic advises discussing omega-3 supplements with your healthcare provider before starting them, especially if you take blood-thinning medications like warfarin. Omega-3s can have a mild blood-thinning effect, which can be beneficial for heart health but may pose risks for certain individuals. Whether you choose fish, seeds, nuts, or supplements, the key is consistency. Regular intake helps maintain healthy omega-3 levels in the blood, supporting reduced inflammation, better blood flow, and a lower risk of dangerous clots. By incorporating a variety of these sources into your weekly routine, you can protect your cardiovascular health in a way that's sustainable, enjoyable, and tailored to your dietary preferences. I'll never forget one of my patients, Mrs. Lan, a 72-year-old living in Florida. She had a history of high cholesterol and hypertension, and when I first met her, her diet was heavy on red meat with very little seafood. She admitted she didn't care much for fish and had never thought about its role in heart health. During her initial visit, we ran a full set of labs, and her triglyceride levels came back alarmingly high, well into the range where the risk of heart attack and stroke becomes much more serious. I explained that while medication could help, diet would play a major role in bringing those numbers down. We talked about omega-3 fatty acids and their proven benefits for heart and vascular health, especially for older adults with her risk profile. I suggested a simple, sustainable plan: replace 2 of her weekly red meat meals with salmon, add 1 meal with sardines, and start her mornings with a tablespoon of ground flaxseed stirred into her oatmeal or yogurt. We also discussed preparation methods, baking or steaming her fish to preserve the omega-3, and I gave her a few easy recipes to try so it wouldn't feel like a chore. At first, she was skeptical. Old habits are hard to change, especially when certain foods have been a part of your routine for decades. But she was determined to take control of her health and agreed to give it a try. She even started experimenting in the kitchen, seasoning her salmon with herbs and lemon, and finding canned sardines she actually enjoyed. 6 months later, we repeated her labs. The results made both of us smile. Her triglycerides had dropped by 35%, her blood pressure readings were consistently lower, and her overall cardiovascular risk was significantly reduced. But the most rewarding moment came when she told me, "Doctor, I can walk around the block without feeling out of breath anymore." This wasn't magic, and it wasn't a quick fix. It was the predictable outcome of small, evidence-based changes compounded over time. By increasing her intake of omega-3-rich foods, she reduced inflammation, improved blood vessel function, and supported healthier blood lipid levels. Mrs. Land's story is a perfect reminder that even at 72, the body can respond remarkably well to the right nutrients. It also shows that you don't have to overhaul your entire diet overnight to see results. Just a few targeted changes, applied consistently, can make a measurable difference in heart health and overall quality of life. For older adults, getting the benefits of omega-3 while staying safe starts with choosing the right fish. Opt for varieties that are naturally low in mercury, such as salmon, sardines, and herring. These options provide high levels of EPA and DHA without the heavy metal concerns associated with certain larger, predatory fish. On the other hand, it's best to avoid species like shark, swordfish, and bluefin tuna, which tend to accumulate much higher amounts of mercury and can pose health risks, particularly for seniors. If you're currently taking blood-thinning medications such as warfarin, it's essential to speak with your healthcare provider before significantly increasing your omega-3 intake or starting a fish oil supplement. Omega-3s can have a mild anticoagulant effect, which can be beneficial for heart health, but when combined with prescription anticoagulants, it may increase the risk of bleeding. Your doctor can help you determine a safe dose and monitor for any potential interactions. It's also important not to overdo it. While omega-3s are beneficial, consuming more than about 3 grams of EPA and DHA per day from food and supplements combined can raise the risk of bleeding problems. This is especially relevant for older adults who may already have conditions or take medications that affect blood clotting. Staying within recommended limits ensures you get the heart-healthy benefits without unnecessary complications. For the best results, omega-3 intake should be part of a broader heart-healthy lifestyle. Pairing these healthy fats with a diet that's low in sodium helps maintain optimal blood pressure and reduces strain on the cardiovascular system. Limiting processed and salty foods while focusing on fresh vegetables, fruits, whole grains, and lean protein sources creates a balanced approach that supports vascular health on multiple fronts. Vegetables and fruits in particular provide antioxidants, fiber, and micronutrients that work alongside omega-3s to reduce inflammation and improve blood vessel function. A colorful plate with greens, reds, oranges, and purples delivers a variety of phytochemicals that help protect the heart and slow the progression of atherosclerosis. When combined with regular omega-3-rich meals, the benefits are even greater. In short, safe and effective omega-3 use for seniors comes down to 3 main principles. Choose low-mercury fish, consult your doctor if you're on blood thinners, and avoid excessive doses. By following these guidelines and integrating omega-3s into a balanced, plant-rich, low-sodium diet, older adults can protect their hearts and circulatory systems while minimizing risks. Protecting your heart as you get older doesn't have to mean making dramatic lifestyle overhauls or relying on expensive medications. Often, it's the small, consistent changes that make the biggest difference. Something as simple as swapping a serving of red meat for a piece of baked salmon or adding a spoonful of chia seeds to your morning oatmeal or yogurt can deliver lasting benefits to your cardiovascular health. These minor adjustments are easy to maintain and, over time, can help lower triglycerides, reduce inflammation, and support better blood flow. One of the most important truths about heart health is that your heart rarely sends clear warning signals until a problem is already serious. Conditions like atherosclerosis can develop silently over years or even decades, and by the time symptoms appear, such as chest pain, shortness of breath, or unusual fatigue, the underlying disease may be advanced. That's why preventive action is so valuable. By making heart-friendly choices now, you can often delay or even avoid serious complications later. Omega-3 fatty acids are a powerful example of a nutrient that works quietly but effectively in the background. They help keep blood vessels flexible, reduce harmful fat levels in the blood, and lower the risk of dangerous clots. Whether you get them from fish, plant-based sources like flax and chia seeds, or supplements, the key is to make them a natural, regular part of your diet, not an occasional addition. Consistency matters more than perfection. You don't need to aim for a flawless diet. Instead, focus on gradual improvements that you can stick with for the long term. Maybe that means adding one extra fish meal a week, keeping a jar of walnuts in your pantry for healthy snacking, or experimenting with new recipes that make omega-3 rich foods something you look forward to eating. Think of these changes as an investment. Just like setting aside money for the future, each omega-3 rich meal is a deposit into your long-term health account. Over months and years, those deposits add up, giving you more energy, better endurance, and a lower risk of heart attack or stroke. Don't wait for a wake-up call in the form of a medical emergency. The best time to protect your heart is now, before symptoms appear. Start today and make omega-3s a natural, enjoyable part of your routine. By doing so, you're not just adding years to your life, you're adding life to your years, keeping your heart strong so you can stay active, independent, and engaged in the things you love. If you found this video on omega-3 rich fish and seeds for senior heart health helpful, please take a moment to hit the like button. It really helps us share more practical, science-backed tips for aging well. We'd love to hear from you, so drop a comment below and let us know your thoughts, your own experiences with adding salmon, sardines, chia, or flax to your meals, or any questions you'd like us to answer. And of course, don't forget to hit the subscribe button and turn on notifications, so you'll never miss our latest heart health insights and nutrition advice for older adults. Stay informed, keep your heart strong, and we'll see you in the next video.